Hello, everyone. Today we have a special guest, Carlos Acurio. He's a doctor from Peru who just matched into neurology at the University of Cincinnati in the US. We will talk about his journey, why he chose neurology, how he studied for his exams, his research experience, and his tips for other doctors and medical students who wants to train in the US. Dr. Acurio, thank you for being here. To start, can you tell us a little about yourself?
Yeah, sure. So, hello everyone. My name is Carlos. Thank you, Gabriel, for the invitation. For everyone who just speaks Spanish, this is going to be recorded and translated on YouTube, so don't worry about it. So, I am a physician from Peru, as you know. I was born and raised in Cusco, and then I moved to Lima to study at Universidad Peruana Cayetano Heredia. And now I just beginning residency, hopefully in July at University of Cincinnati. So that's my story.
Why did you choose neurology and when did you make that decision?
But that's a very good question. It's a question I responded many times during my interviews. I will say the thing with neurology is that people like to think, and I like to think. I really love to, you know, spend hours perhaps thinking about something, and I think neurology offers that, you know, diagnostic reasoning possibilities to do that. In neurology, you need to know the connections, but you need to also know how, where every part of the nervous system is located in order to do a very or a comprehensive neurological exam. And you need to know also how things are integrated in the brain to get to the diagnosis of a patient. So really is a field that is very welcoming for people who like to think and keep thinking about solving puzzles, and that maybe is the very common concern of neurologists is people who you see it and think and are somewhat quirky with the way of being. I will say another thing that is good about neurology is that it's very rapidly growing and rapidly expanding field. In neurology, we have several subspecialties. Probably for the guys that live in Peru, you are not that familiar with how many subspecialties and how many pathways you can do in neurology, but it's a lot. I have seen at least 13 subspecialties, 13 ways to go when you are a neurologist. So you can do stroke, you can do neuromuscular, you can do cognitive, you can do epilepsy, you can do movement disorders. There is really, really a lot to do. And every one of these areas is growing. Right now, we have new treatments for stroke, we have new treatments for Alzheimer's disease, new ways of comprehending and understanding Parkinson's disease. So it's really a very exciting field to be right now.
When did you make the decision to choose neurology?
So I started med school thinking doing something about the brain, um, perhaps neurology, perhaps psychiatry, perhaps even neurosurgery. The first time I entered to the OR, I knew that wouldn't be my pathway, uh, probably, but um, I I guess that at the with the courses that I was taking on in med school, the neurology clerkship, the psychiatry clerkship, even the surgical clerkship, I tend to you know go into a certain direction, and that direction was neurology. I think by fourth year of medical school, I decided to went into neurology.
Okay. And when did you start preparing for the USMLE exams, step one, step two?
That's a very good question, and I think the pathway is very different from many people. But for me, I think I decided to go to the US between 4 to 5 years of med school. So in Peru, we do 7 years. So around the middle, I will say, um, I started researching about preparation and about uh, things in order to get to the application to the US. I will say between fifth to sixth year of medical school. Um, I didn't start studying much for the steps much later, up to, I will say, 1 year after I was out of medical school. Again, everyone has a different path. I know some of my colleagues and friends who started medical school thinking they were going to go to the US. I know people who decided years after leaving medical school to go to the US. So everyone has a different path.
Okay. And what study materials did you use for step one?
Oh, that's a good question, and I don't think I'm the best example, because I did research profoundly on study materials, but at the end I end up using mainly UWord. So I started my preparation in 2023, and I was, very pressured with time. So I took around 6 months to study for step one. So I needed to use the main resource, and the main resource for me was UWord, and I believe that is the most common opinion among people who is preparing. I will say there are some other resources that are very useful and that many people also recommend. First Aid, that is this book that um, they release every year. I think it has all the information for step one, and it's very useful. I will say, regarding pathology is a big part of the step one. There are some videos from the Patoma videos. I've seen some of those videos, and they are very good, and they really help you comprehend things in things for basic science in for the step one. Another resources I heard that are good are, for example, videos from Boards and Beyond, and for Kaplan. They have videos in almost every topic for the step one, and they are very comprehensive and very easy to understand. So it's a good resource. I will recommend it from someone who has more time. I was again a little pressure with the time, so I only end up using UWord, but all these resources are very good.
And can you describe your daily routine or your study plan for the step one?
Yeah, so for me, when as I was again being a little pressure with the deadlines, I use a dedicated time for studying. So I I think for 6 to 5 months, I only studied for the step one. I was doing a bit research, but that was kind of, peripheral in my work. I didn't spend too much time doing that, at least at the beginning. So for me, it was kind of waking up at 8 or 7, and then going to the library because I love libraries, and I usually study in libraries, and then staying there up to it closes. That it closes here in Cusco, where I'm located, around 8:30 p.m. I try to do that as much as I could. I will have to disclose that I didn't do that every day. I think that was my initial plan, but things aren't always as you plan and aren't always ideal, as you know. So there were days that I didn't go to a library at all. There were days when I, went to a library for a few hours. There were days when I went to a library for 3 hours, but I didn't, get to solve any questions because I was burned out. Um, and I will say there were even weeks when I didn't advance much in my study plan. Um, but again, I think the key for everyone who is preparing for these exams is persistency. Is knowing that if you fail one day, or you didn't do as well as you wanted to do one day, you may do better the next day or the next week. So I will say the thing for me was persistency.
And what study materials did you use for step two?
Well, that's a good question. I will say for step two, UWord is even more relevant than for step one. I think at least in the things that I have read, in blogs and Reddit and different web pages for studying for the steps, um, first say kind of loses relevance. And now don't quote me on this, but it's what I heard. Um, and I think that the most important thing and I think most people will agree with me. There are other questions banks that can be used. I heard Ambos is very good. So I think you can complement it with Ambos as well. Of course, there are other materials because for people who don't know, step two is clinical sciences. So you can complement it with clinical resources like UpToDate. UpToDate is a very good resource. I will say some papers or some review papers, the New England, the JAMA, Annals of Internal Medicine. They post several review and clinical practice materials frequently, so you can check them out, and it's a very good source to review a topic. Also for neurology, we have Continuum. Continuum is a great source for updating your knowledge in neurology. I will say that we have. I met various people who use Anki cards or Sankey cards. Is a very good resource for what I heard. I didn't get to use it because I didn't have much time, but it's a very good resource. I think it has, kind of compressed your questions in every card. So I will definitely recommend people to use that as well.
And how did you organize your time for step two preparation? What was your daily routine? And how long did you prepare?
I try to study as much as I can, and I usually try to study 6 hours of the 7 days of the week and take one day to rest. That was not always the case. I end up resting 2 to 3 days a week, some some weeks, but that was my initial plan. I heard again from other people other different plans, especially for people who work. They try to study at least 6 hours a week. I try to study at least between 8 to 10 hours a week. But if you have other things to do, that time may be reduced, and it may take you longer to cover all the topics for the steps.
If you had to do the steps again, what would you do differently?
So one thing I will like if I had the opportunity to do it again, one thing I will change if I will have started earlier. So just to give some context, in Peru we do 7 years, yes, but we do, I think the first 3 years is basic sciences and the last 4 years is clinical science, including the internship. So I will have started my preparation for the step one early. I think first or second year of medical school, and I will probably take the step one finishing third year of medical school or in the middle of fourth year of medical school, and I will have taken step two, I think around six or 7 year of medical school. Um, Again, everyone has a different path, but if I had the steps in mind, probably that's the best strategy to do it. In that way, you don't have to review all the topics ever again once you leave medical school. Particularly, basic science can be a little challenging for people who don't who start studying after graduation. Trying to review topics that you learned 4 years ago is kind of challenging. So definitely I will have started earlier. Another thing is probably I wouldn't focus too much in finding different resources because at the beginning I tried to find everything I could. I tried to get the best material available. Not only UWorld, but Kaplan, Boards and Beyond, Patoma, sketchy videos that are good for microbiology and pharmacology. And I ended up compiling all this information that I didn't use. So I will have probably stick to only one or two materials, at least for step one. I will have stick to only one or two materials. Probably Sankey cards or Anki cards are a very good resource to keep reviewing topics even after you pass them or make a school. So I probably will also use Anki cards or some kind of question bank.
About medical research, do you remember your first research project?
Yeah, and I think research is it has definitely a role in the application for residency to most specialties, I will say. I don't think it is the path for everyone. I don't think that you have to do research if you don't like doing research, but definitely it helps. And if you like to do it, we need more people to do research in Peru, definitely. I think that I tried several times in medical school doing research and I failed. I tried to do um, several protocols, and many people may identify with that. But sometimes when you carry on a project, you get to a part when you just get stuck and you don't know what to do, or you find out that that your idea was very difficult to make in practice. So I think that the breakthrough for me was after medical school. After medical school, and Gabriel, you know this. We started a group called Astroside with Niels, Fritz, and Diego and Fernando. We try to teach each other some things. Particularly Niels taught us a lot of things about research. We tried to connect with senior members as well, and then we started doing some projects and some reviews that we sent to congresses. I think one of the big things for me at that moment was a review we did on endovascular thrombectomy for posterior circulation strokes in Latin America that actually got an oral presentation at the American Academy of Neurology. And it was a very exciting work. And we did find out, how useful can thrombectomy be in Latin America, because we don't have um, much data here that is, um, you know, strong enough to say we can use it. And again, we found very interesting results, as you remember, regarding efficacy, very, very similar results to other countries. Maybe a little bit higher in the terms of safety, but all those things, I guess, can be taken also with a grain of salt. Um, as most of our studies were observational. But again, going back to the part of research, I will say a big thing for research, at least in my pathway, was mentorship. I think that one of the things that was missing for me to do research in an efficient way was mentorship. And that was, I will say, the thing that changed between me trying to do research in medical school and me actually doing research after medical school. And that is the thing that we want to provide with our group, Astrosite. We want to provide mentorship for people who want to start doing research.
And what skills do you think are important for doing research in neurology? For example, statistics, writing, teamwork, discipline, or another one?
So I will say that the most important skill, at least in my opinion, is curiosity. Definitely, is curiosity is having this thing of questioning how things work, and how can we get additional information to help our patients. I don't think there is, at least in my opinion, I don't think there is a set of skills that everyone should has in order to succeed in research. I will say common things that I heard that are good are, for example, teamwork. Teamwork is very important not only for research but for everything actually. Even for working in clinical practice is very important. You need to know, how to trust your peers and how to communicate efficiently with your team. If you can do that, you will end up, just facing a huge obstacle by yourself, and that is, in my opinion, very inefficient. So working in a group definitely helps. I will say regarding knowledge and regarding skills, you do have to have some foundational knowledge on epidemiology and statistics. You at least have to know, what kind of study design you're reading. How is the methodology of the study being done, and how can you interpret the results in the context of the study. So yeah, definitely epidemiology goes a very long way at doing research. Regarding statistics, I will say that the thing that you essentially need to comprehend is how the different statistical tests works and how and that is good in order to interpret the results. And don't say this definitely proves something when you are using um, an statistical test that is not that solid, for example. Um, and I will say that advanced statistics, like knowing how to operate different softwares, is useful, but not necessarily. I will say that in most big research groups, there are people who actually, are fully dedicated to statistics. So if you are part of a big research group, you will probably have someone that can give you a hand in that. And yeah, persistence is something that I will say is very important, particularly for things that may not have worked out according to the plan. So if you have a timeline to finish something in 1 month, or I don't know, 3 months, and you end up taking 6 months, you definitely need persistence to continue working. Uh, I do have to say this, that at least in my experience in many research centers in Peru, we are kind of expecting things to be done in a in a very responsible and definitive way. For example, if you are to belong to some research group, they will expect you to fulfill your obligations within the timeline. They will expect you to meet deadlines. Most research groups that I met expect you that. What I will say, especially for medical students, is that your main duty is your studying duty, your clinical duty. You have to approve and pass the university. Um, Research, at least in my opinion, for medical school is kind of a secondary thing. It's not your main goal. As for example, in a hospital, if you're working in a hospital, your main goal is to treat patients, and you can do research, yes, but that is kind of secondary. So um, at least what we try to do in our group is try to be more understandable and try to define goals, but trying to individualize everyone's decision, or everyone timeline. So we try to not just expect from you to do things in this timeline that we set up for you, but we try to make a conversation with you on how much can you support and what is the timeline that works for you and that also works for us. So I will say that understanding and empathy also goes a good way for research, at least in my experience.
About clinical experience, what rotations did you do in the United States?
Oh yeah, so I think I did too many. So please take my opinion again with caution, because I don't think that everyone should do as many as I did. So I started doing rotations in 6 years, 6 year medical school. My first rotation was an observership at Doctor Hospital Arena Science, that is in a city called McAllen in Texas. I did cardiology there. With Dr. Robalino, who is a Peruvian who is an interventional cardiologist there, and he's an excellent human being, an excellent mentor. Um, After that, I well, I was expecting to do some rotations with the Harrington program. For everyone who doesn't know about the Harrington program, is a program set up by the University of Miami to try to provide observerships for immigrants. I think they take both students and doctors to do observerships, and it's a great program. It's great to be at Jackson Memorial in Miami. And I was going to do a rotation for University of Pennsylvania. At the end, all those rotations got canceled because COVID came. So COVID canceled everything. Um, so it was kind of this disappointment for me. I will say that it was kind of this uh, at least huge barrier for me, because I was really excited to do those rotations, and then all of a sudden everything closed. So I will say, for people who are in similar situations, when you are expecting something, even if you got something already approved and you are ready to go to some place, and that ends up being canceled at the last minute. uh, I know it's hard. I know it's disappointing, but please keep trying. um, Please keep working on it, because even though some opportunities close, new opportunities open. So I try to do that, and I try to research, and I try to investigate and look out for different Peruvian people who are working in neurology at the US, and I try to contact them. And that's how I got my second and third rotation. I work also. I went also at again at McAllen at DHR, and contacted neurologist who was Mexican, was working there, and he was really nice. And then I went to a private clinic in San Diego and worked with another Peruvian neurologist. After that, during my internship, I also did a rotation at Baptist Hospital with another Peruvian neurologist, Dr. Felipe Los Rios. He's an amazing guy. He has, this way of teaching that is very good, and he loves to teach, but he also is, a very knowledgeable guy. So that was a very good rotation for me, and the rotation that actually set up I would say my interest towards stroke. That is something I really like right now. After medical school, no, at the end of medical school, I did made a clinical elective. So the Kansas University Medical Center offers medical or clinical electives for immigrants, and they have a program when you spend 1 month in a house with at least in my case was with three other IMGs, and every one of them gets to rotate in a specialty at the hospital. So I did a rotation in neurosurgery there. It was a very good rotation. It was very demanding, yes, but I did get to use the electronic medical registry that they use in the US. That is very important, that you learn how to write notes and interview patients, and that's some of the things that you can do in a clinical elective. After medical school, I I couldn't do any more electives. So this is again another point of context for the people. When you are in medical school, you can do these things called clinical electives or clerkships or sub-internships, when you can actually talk to a patient, you can interview a patient, you can do a physical exam, and then write notes, um, work with the team, as one of them per se. Um, but once you leave medical school, you can mostly do what we call observerships. So observerships are still good. You can still see how people are being treated in the US. You can still see how the medical system works. Even if you are listening very carefully to a patient presentation, and you go with a resident or with a medical student that offers to help you out by examining the patient and by interviewing the patient. You can even do a patient presentation, or you can even do, write a case report or do some research activity in an observership. So after medical school, you mainly can do observerships. And after I leave medical school, I did another two observerships. I did one at University of Florida, when one of my mentors, Dr. Miguel Chuquilin, was. Um, he was a neuromuscular attending there, and it was great because I get to spend time with the residents, but also in consults and in clinic visits. Um, and then I did a rotation at Prisma Health, that is in South Carolina, and another Peruvian neurologist there. Dr. Revilla is the chair of the neurology department there. So it's a very interesting rotation regarding movement disorders, and I think I learned a lot from it. Um, at the end, just before applying, I did a rotation. I did an observership at University of Cincinnati with Dr. Alberto Espe. He's a huge figure in neurology and in movement disorders, and probably one of the best persons or one best people I know. He's such a kind person and really likes to teach. Um, and I didn't also spend some time in the hospital with the residents at Cincinnati. And then I went back to UF. Um, I will say I had this, I heard this advice once or twice, and it was very good. So I will share it with you. And it's that if you are really interested in a place, when you know, in a place that you want to match, for example, for me, University of Florida and University of Cincinnati were places I really wanted to match. So they recommend me to go there or rotate there, near the time of the application. So they have a fresh memory of you and your skills, and you can make contact with the residents. I think that was a good advice. I ended up matching at University of Cincinnati, and I will say that me interacting with the residents and interacting with the faculty there was a huge role for me matching there. Yeah, so those were the rotations I did.
And how did you get your letters of recommendation, and what is that?
So, in order to apply to the match, you need letter of recommendation, and letter of recommendation and are used, letters that people who have worked with you, particularly attendings, can write in order to recommend you. Um, so I got my letters of recommendation by doing rotations, by doing observerships and the clinical elective. I will say that as I had the opportunity to choose, I choose the letters from the people that know me best and that work with me with the longer time. You need for the application, you are required to provide, at least for neurology, 3 layers of recommendation, but you can provide up to 4. In my opinion, if you can put 4, put 4. I don't think it will stations, I try to set up, this relationship with my mentors, with the people that were my sponsors at the rotation. So even when I left, I tried to, send emails, ask them for advice, just say Merry Christmas or Happy New Year or Happy Birthday. So I could establish a longer relationship. Actually, with one of my mentors, we were working in several research projects, and that also helped, and try to establishing the long term relationship. Um, and yeah, definitely, I try even after I left, I try to keep in contact with my mentors, at least with the ones I believe were gonna write me the letter of recommendation. About this is a common question also about when to ask for a letter of recommendation, particularly if you are in medical school and you are thinking applying, in the next several years, but not at that moment. Um, so what I heard is that one thing you can do is you can ask them to write you a letter of recommendation after the rotation. In that way, everything you have done is easily remembered by the one that is writing. Um, Many attendees are very busy, so sometimes they will not write one for you when they know you are not applying that year. But you can at least try. And the other thing that I heard is that you can ask, several years later, like in my case, I asked several years later, but again, I try to maintain a close relationship with my mentors. I try to, send emails and try to involve them in my research projects and try, ask them for advice. So in that way, I maintain communication with them, and I think that's also a good a good alternative to getting a good letter of recommendation.
About mentorship, how important are mentors in the match process?
Oh, I think for medicine and for the match and for everything, mentors are huge. Mentors are huge. So I think that uh, if you really want to succeed in something, having a mentor that teach you the way that that he has done things, and the way that he may have changed things in his career plays a great role. I think mentors are very important, and regarding mentorship, sometimes we think as mentors. When we think in mentors, we think people who are very old and knowledgeable and have the highest ranking in their profession. That's not always the case. You can have different types of mentors. Even in medical school, you can be a mentor of your peers, or you can be a mentor for high school students, or even when you are a resident, you can be mentor, or when you are just an attending, you can be a mentor. So you can have a lot of mentors and at the same time have a lot of mentees. Um, so mentorship is just guiding, right? So if you can guide somebody in anything, that makes you a mentor. And if you can be present in the pathway of somebody and try to offer some help, that makes you a mentor. And I will recommend for people to try to get different mentors and for different things. So you can have a mentor for research, you can have a mentor for professional life. Um, you can have a mentor for rotations. You can have a mentor for, I don't know, voluntary, or a mentor for things outside of medicine. So having different mentors is actually very good. So another term that is important, and I heard commonly lately, is that you may benefit from a mentor, yes, but you may also benefit from a sponsor. So the thing with mentors and sponsors is that a mentor is somebody that guides you, but a sponsor is somebody that kind of tries to represent you, or try to you know provide the best version of yourself to other people. So, for example, you may have a mentor in medical school that works in Peru and that actually guides you to the neurology clerkship and how to do a proper neurological exam. That's great. But you can have a sponsor in the US that says, "Hey, this guy is the best. This guy is very brilliant. Is very responsible, and I recommend this guy for going to your program, or I recommend this guy for taking part of this research project, or I recommend this guy for this position in the university." So having a sponsor also goes a long way. Sometimes your mentors become your sponsors, particularly as you move in your career. So the people that guide you actually help you get a work, or get a job after you leave, residency or fellowship. So those things can be interchangeable, but definitely having those is good.
And can you share some tips writing a great personal statement? And what is that?
Yeah, so again, in order to do the application for residence in the US, you are needed to provide a personal statement. And a personal statement is basically, a letter that you write to programs to kind of tell your story, and tell what do you want to apply to a specialty? Why do you want to apply to neurology? Why do you want to apply to that program? Or what experiences have shaped your professional career into this direction? The most common advice I read is that you need to be original, or it's best if you are original. Um, there is not a clear path on how to write the best possible personal statement, but uh, the most common thing I heard is that you need to put your own experiences and try to convince the program that these experiences actually make you a good fit for the program. So, for example, if you in medical school started an organization in neurology or an organization in neurosciences, that may be very appealing for a program that is looking for leadership. If you, after medical school, work as a research fellow, that may be appealing for a program that is trying to expand their research work. If you do a difficult case during medical school or after as a doctor, you solve a difficult case and that really shape your way into neurology. That may be appealing as well for somebody who is looking for a dedicated person who really cares about patients. So all those experiences are yours, and you need to probably, just trying to convey them in a way that uh, is easy to understand, and really reflects what you have been going through. And I will say that everyone who is applying, and everyone who is in medical school or in any school, has those experiences. I will say that you just have to make a good self-reflection about what you did in your life, and you will find a good experience to share with others that will tell your story, but will also tell how can you be a good member of a residency program.
And when applying to programs or hospitals, there is something called it signaling. Could you explain this topic to us and share some tips about it?
Yeah, definitely. And signaling is something I would say that was applied in the last years, and it's a good way for programs, particularly programs that receive a bunch of applications. Like for example, in internal medicine, they can receive 800 applications. So it's a good way to know who is really interested in the program. Um, so it varies according to specialty. For example, in neurology, we had ACE signals. So between all the neurology programs that we apply, we could choose 8 programs that were our, most wanted programs. And as applicants, we can signal them, and the programs will know that we are particularly interested in that program. I think for internal medicine is a bit more complex thing. They have, I think, gold signals, and they have silver signals and bronze signals, if I'm not mistaken. So it's actually in a level of what you want most and what you maybe want a little bit less, and then a little bit less. So yeah, it was designed for programs to know who is really interested in. And I think that some data shows that it may have played a role in programs to select candidates for interviews. There is some data on the NRMP website about how important were signalings and also geographic localization. That is also another new thing in order for people to get interviews. I will explain briefly about geographic localization. So, at least for neurology, you had the opportunity to put, I don't have a geographic preference, meaning I can go anywhere in the US, or you can select 3 areas, including many states that you will most likely to go. For example, if you have family in some state, or you have a deep connection with some place, you can select a geographic preference, and that may also help you get an interview in those areas.
And how did you prepare to the interview stage? How long did each interview last?
So for the interview, it's kind of a balance between being sporadic and original, but also being prepared for the questions. So definitely there are some common questions that you are going to hear. For neurology, it was, why do you like neurology? Of course, it's the first question. Or why do you like this program? Or tell me about yourself. That was a very common question. Or tell me about this thing that you did in, I don't know, in research, this experience that you have. So there is a set of questions that are very common for most interviews. So I think you have to balance how well do you want to know and prepare for these questions. Meaning, for example, if you are going to be asked, tell me about yourself, probably will be best to have, I don't know, some pre-made speech of 1 minute telling about your story in an understandable way. Um, or if you are going to be asked about why do you like neurology, probably you need to have somewhat of an answer already prepared, but you don't also want everything to be rehearsed. You want to have originality in your answers, so you also don't want everything. You don't also want to sound like a robot, right? You don't also want to give a mechanic question, a mechanic answer. Um, so again, it's a balance. It's delicate. In my experience, what I did was I think, some mock interviews with some residents, some friends, some attendings. I will say I did around 3 to 4 mock interviews. Then I did kind of read the common questions, I think, for an hour or two, and then I just let myself, try to be original answering the questions for every program. And I think that worked for me. Again, the first interview is always going to be difficult, but the more you advance through your interviews, the more you will be prepared for the next one.
And was there any question during the interviews that surprised you?
Yeah. There were a lot of questions that surprised me. I remember one common question that was actually surprising. Is that why do you want to come to the U.S. Even though you have this established background in Peru, uh, even though you have this uh, connections and you have all your life in Peru, why do you want to go to the U.S.? Um, so my question was, I want my answer was, I want to keep moving forward and keep specializing and subspecializing things that are somewhat limited in Peru, in order so I can go back to Peru and provide better care for my patients. So it closes the cycle. Another question was, what qualities do you think a neurologist should have to be a good neurologist? And that was, again, a very good question, I would say. Um, I think, curiosity goes a long way in everything. I think being comprehensive and being very minutious is a quality of a neurologist. And also, liking to think is a very common quality of a neurologist. I'm trying to think in another question that surprised me. I will say weaknesses. What are your main weaknesses? Or sometimes they put cases for you. They put, what would you say is an ethical dilemma that you have faced? Um, that was very common. Um, I never got, well, I only once got asked a neurology question that surprises me. So I did a rotation movement disorders, as you know, and they asked me about, what are the main characteristics of Wilson disease or PSP. I did 20 interviews, and that only happened once in only, one part of the interview. I wouldn't say that is common. I wouldn't say that is common. Um, but yeah, definitely that surprises me because that is not the kind of questions that most people ask. Most people like to, don't want to know if you have the knowledge. That is why the steps are for, but they want to know if you can work with a residence in the residency program with the rest of the team, if you have some qualities they are looking for. Um, so most of the questions were related to that.
Now about global collaborations, was there anything you learned during the interviews that surprised you about neurology programs?
Oh yeah. So I will say that regarding global collaboration, um, the the thing that I really like when were programs in the interviews were trying to focus on a global scale. I really like global neurology, and I think it's a very useful way of thinking when you are working in different areas. Um, so some programs actually ask me about my work in global neurology, or my work trying to connect people. I will say that part of my work was joining the AAN. The AAN is the American Academy of Neurology, and it's a huge organization that, again, it's the American Academy of Neurology, so it's US based, but it has people from all over the world, and it constantly try to improve things, in all over the world. So the agent has many things for medical students and for physicians. One of the things they offer is resources for medical students. You have a lot of when you are a member of the American Neurology, you can access several publications, you can access several videos that the or educational materials that the academy produces, but also you can join certain organizations. So there is this web called Signups, where you can join the Medical Student Forum, and they constantly, publish opportunities for medical students, or things for me that could be interesting. Also, you can join what is a sign chapter, which is the student interest group in neurology chapter. And that is very, very, I would say, useful and very, very interesting to do. A very, very interesting thing to do. Science chapters can really connect you with the rest of the world in neurology. Can really connect you with other medical students. Can connect you with attending physicians from every part of the world, basically. So I always encourage people to start their science chapter, or to join a science chapter if a university has one. I started with Niels, actually, the first science chapter in Peru. That was, I would say, 4 to 5 years ago. Right now we have three science chapters in Peru, but I think we will have more. And the more we are connected with the rest of the world, the more we will, enjoy neurology and advance things in our country. Um, another organization that I really like is the MDS, the Movement Disorder Society, and SBIN, which is the Society of Vascular Intervention and Neurology. And yeah, I really enjoy the topics that they publish, and they also have, I think, some space for young trainees to learn about those topics.
And how was your experience at the American Academy of Neurology Congress and the MDS Congress? What did you learn from it?
Yeah, those were, for me, they were the best experiences ever. So I only got to go to a congress after medical school. I wish that I had gone to a congress before, particularly during medical school, because they really changed your perspective in things, and they really changed the way that you may think something. And that is why I actually like global collaboration. So I will do, an aside point. What I really like about the global way of thinking of global collaboration is that you can find many resources. For example, if you are seeing a patient in here in Peru, and you are seeing, you don't have an MRI, you only had that CT, or maybe you don't have enough, treatments to provide. You can call somebody from another country. You can call somebody in the US or in Europe, and you can say, "Hey, can you do an specialized, view of this patient?" And maybe in Peru we don't have vascular neurologists, but in the US they do have vascular neurologists. And a vascular neurologist can tell you a lot of things even by looking at a CT. So you can have, when you are limited, when you are in a resource limited country, you can have a lot of new resources by doing global collaboration. And also, if you are in the other place, if you are in a resourceful environment, um, you may also found another skills that we have in Peru. So, for example, in Peru, or in a under resource area. We are very creative in our way of think of treating patient. So when we don't have all the alternatives for treatment, we try to improvise and come up with something that may be useful. Or we are very focused on our neurological, I mean, in our physical assessment and in our history, because we don't have as many other resources to diagnose. So all those skills can also be very helpful for people in the US or in Europe. So global collaboration goes both ways. But going back to the point of congresses, so I went to my first congress, the American Academy of Neurology annual meeting in 2024, and I went there with a scholarship. The AAN offers this international scholarship to the AAN meeting, and it's great. It's available for international physicians, and it was a huge stroke of luck that I got that. So I went there. I connect with many people. I saw many posters. I actually wrote a bit of my experience in a blog in neurology after that. Um, and yeah, I did get this kind of small celebration with the other recipients of the international scholarship. So it was great. It was definitely a life-changing opportunity. I also find out of new treatments or new things I could establish at my own institution at Peru, at Astrosite, new ways of thinking or new ways of organizing things that could also help that organization. The MDS Congress was very similar in that sense. I will say that the MDS Congress is a bit more specialized. It's not neurology, it's movement disorders that is a part of neurology. So you find more specialized talks. But again, the connections, the networking, the activities are very, enjoyable. So I will advise everyone, even if you are a medical student, because I've seen high school students there, even if you are a medical student, go attend a congress. It's a life-changing experience.
Okay, Dr. Carlos, now that you have matched, how did you feel about your future in neurology, your future in medical research, and your training in the US?
Well, I'm scared and I'm a bit nervous because residency is a huge task and it's going to carry its own difficulties. Um, Definitely getting into residency was also a long trip, but this is the start of another trip. So I'm scared, but at the same time, I'm very excited because being a resident can give you new opportunities to connect, new opportunities to work or specialize in something. So that's definitely great. I will say that one of the things I would like to do, and I think that is the common thinking in Astrocyte, is we want to help more people getting in. We want to help more people going to neurology. We want to help more people getting, specialized and sub-specialized training. And we want particularly more people in Peru. Is very needed people who with a subspecialty neurology is very needed. So we want to keep expanding. We want to offer new resources, and that is another kind of subjacent goal that I have. Try to bring more resources to medical students and to young physicians who are part of our group on Astrocyte, and for everyone in Peru who wants to join neurology. I would like to provide more resources. And I think that is the same way of thinking of Niels and all the people who like neurosurgery as well. They want to not only grow and keep advancing in the field themselves, but they also want to bring everyone with them. And I think that's something that is going to be possible in the next years.
Dr. Agorio, and thank you very much for your time, Dr. Carlos. Could you give some closing remarks to end this meeting?
Yeah, I will say for everyone who is watching this and wants some mentorship and some guidance, we do have a group. We have a group called Astrocyte who wants to provide just that. I myself individually would like to provide mentorship and guidance to everyone I can. Even though I'm just a small ant here. I'm just starting my pathway. I would like to help everyone I can, and I think that's the common thinking in our group as well. So just for people who are starting thinking in neurology or neurosurgery, please know that you have some resources, and you have um, some support if you want to have it. And yeah, good luck with everything.